So thank you so much one more time for taking the time to talk to us in regards to the Women's Health Program at South Boston Community Health Center.
Hmm.
And this is a very good opportunity to discuss this topic. I've been reviewing some of the UDS data, and I've seen that probably around 55% of your patients are female patients. And most of them, 51.39%, according to the 2016 UDS data, are between the ages of 15 to 44. So I would like to ask you if you could give us an overview of the women's health program that you have in place.
Yeah, so as far as women's health goes, it's kind of, I would describe it as a little chunky. So we have a family planning counselor. So for those younger women who are interested in birth control or any sort of family planning, they can go and work with our family planning counselor. Um, then we have then it kind of like skips up to like the OB program. So we have a medical assistant who is our OB navigator, and she tracks all of our OB patients, their pregnancies, deliveries, especially for the UDS data to make sure we know where those deliveries happen, when they started care, if they've got all the tests that they need or are required. And then she tracks all the baby's birth weights and all that sort of stuff for our UDS data. And we have a family medicine nurse practitioner who specializes in women's health. Um, and in addition to that, we have in our in our family medicine department, that's the department that houses our women's health group. We have a mix of residents and attendings, and so both of those types of providers take care of our women's health patients, but it's really mostly focused on like the OB
Mm-hmm.
seg
Now,
patients.
in one of the health centers that I've been talking to, some of them have high-risk female patients, specifically teenagers who are either having drug abuse issues. Do you have do you offer services for the high-risk patients, specifically in regards to disease prevention, either tobacco use screening or alcohol misuse screening or uh, behavioral health interventions?
Well, I would say for us, that would happen like within our clinical departments, our primary care departments.
Mm-hmm.
They're screening for alcohol and drug use. Um, and then, depending on how the patient screens, if they screen positive, and depending on that provider's discussion with the patient, then they could do a warm handoff with any of our behavioral health providers. We do have integrated behavioral health, so that makes it nice because the providers are right on the floor in the primary care departments. Um, and then we also have an OBOT clinic as well, and actually just recently started talking about whether our OBOT clinic should start talking to patients about um, preventative testing, like even something like pap smears. Um, so, so we have a
Okay.
little bit of that, yeah, but it's sort of like dispersed in what the clinic does.
Mm-hmm. Mm-hmm. Now, in regards to disease prevention, does the program include any disease prevention and health promotion? I mean, we talk about family planning and probably screening from some of the most frequent STD diseases, I guess. But
Yep.
is there any intervention on specifically regarding disease prevention and health promotion?
I am trying to think, but I would say like really none that I know of,
Mm-hmm.
um, except for probably primarily in our pediatrics department. I think I mean, I know that we're all involved in primary care and preventative medicine, but um, I would say that pediatrics is the most that's kind of like the biggest focus of their practice, because they're really doing a lot of that health promotion and trying to get people to develop healthy habits at an early age, versus like adult medicine that tends to be like more just, unfortunately, more sick care and then trying to do preventative teaching at those visits. So I
Mhm.
would say I would lean towards we don't have much in line of disease prevention and health promotion.
Okay. Now, the other question that I would like to ask you is how do you identify a patient for this women health program? Is based on a patient who is going to the clinic and is seen by a practitioner, or do you have any kind of materials offering the services? How does it work?
Yeah, so our with currently with just the family planning and the OB kind of programs, it would really just be, if a patient showed up to the clinic and said, if a 17-year-old woman showed up to the clinic and said, I'm interested in family planning, or birth control, and I do or don't want my parents to know about it, then they would be referred to the family planning counselor, and she would be able to see the patient right then. We have warm handoffs with her as well. So I would say it's really by patients coming to the clinic and showing interest in whichever program that we have, or like presenting an issue and then us being able to help fill that gap.
Okay. And what are the gynecological services that you offer in general? I mean, some health centers, for instance, in addition to what we've been discussing, they offer folic acid, for instance, to patients to make sure that they don't have any problem during pregnancy. Is that something that you do generally do?
Can you say that again, Jose? I'm sorry.
Yeah, the use of folic acid is very important in female patients. Is that something that when a patient goes to these services, is folic acid offer, and what other services do you provide to these patients?
That's interesting. I do not know. I
Hmm.
assume. I mean, I've seen that commented in charts before, but I don't know. Um, I don't know like how it gets brought up or anything. So
Okay,
I don't know the answer to that one.
okay. What about STDs and HIV prevention? Is it offered to these patients when they go to the clinic?
Yeah, I think I don't know at what age we start talking about it,
Mhm.
but we definitely I know I do a lot of chart reviews for chlamydia testing, and that I think that starts at 13 or 15. Because I know I'm usually in the PD charts when I'm looking at that. But yes, we definitely do offer STD testing, and it's normally something that's brought up during a physical exam, um, or with, I would say again with the pediatrics department, they tend to be um, their practice tends to be more that they would bring up STD testing if they've seen that the patient hasn't had it, even if they're not in for a complete physical, whereas our adult and family medicine departments, when they're seeing adults, would tend to do that just at physical exams
Okay.
or for new patients.
Now, when a patient goes to a family planning or is looking for family planning services, this is also a very good opportunity to review the patient's health history and look for other chronic diseases such as hypertension, diabetes, cervical cancer, breast cancer. Is that something that is done at the clinic, or the person goes back to the doctor? I mean, to the practitioner.
Yeah, that would definitely be done with their primary care provider.
Okay, okay, all right. But it can be referred by the women's health program, right? If they believe that the patient needs any of these services.
Oh, definitely. Yes. Yep.
Okay.
Yeah, we've actually been trying to do a lot more of that, and look for better technological ways that we can do more of um, communicating across different services about when patients are due for, if a patient's being seen in behavioral health, but we know they're due for a cervical cancer screening or a colonoscopy or something like that, how can we do a better job of not just letting the PCP know, but like really coaching and encouraging the patient to set that appointment up or have us set that appointment up while they're with us in the office. So hopefully
that information is recorded in the electronic health record, right? I mean, if someone goes to the clinic and is looking for family planning services, and then the person receives any kind of medication for any of the preventive services that they are looking for, that is recorded in the electronic health record. So next time, if another provider sees the patient, they have access to that information, right?
Yes, exactly. Okay. Yep.
Okay.
Yep.
All right. And then the other question is in regards to funding these services. Do you have like a special grant or is everything provided by CMS and private insurance?
So most of it is covered by insurance, but for the family planning program, we have the ABCD grant.
Okay.
And that's about all I know about that.
Okay. And I just have two more questions. One is in regards to needs. What do you have a sense of what the health needs of these patients are? I mean, they are looking for evidently for family planning services, but in regards to either social determinants of health or any chronic diseases, is there like something that you believe there has to be like some kind of future interventions?
Yeah. So we're kind of like slowly moving in this direction. We're starting to gather social determinants of health data on our patients. So for this year, any patient that comes in that's a new patient or that we haven't yet collected the data, we're asking about homeless status, violence, financial situation, social supports, and I think there's another social determinants of health category that's escaping me right now. But we're asking 5 different domains. So we're starting to gather that data this year. And then we have 2 open positions that I haven't posted yet for population health coordinators, who I'm hoping their primary role is really going to be in outreaching to patients who are overdue for things to get patients in. But I'm also hoping that either these folks or maybe with these folks doing that work, we can free up some time for someone at the health center to look more at our populations to see, we have a risk stratifying tool too, so we know who we think is low, medium, and high risk. So I'd really like to start stratifying those patients to see, of our high-risk patients, which ones are female, what are their issues, which ones are male, why are they considered high risk? Do we need to have some sort of diabetes support group? Do we need a hypertension or a hypertension and diabetes focused support group based on what our patient population looks like? So I think we're trying to get to that point, but we really need some data first. And until then, it's really like by patient when they see their provider, what needs do they have? And then I think we have a relatively large, I don't know for sure, but it feels large, behavioral health staff with case managers who will help patients get access to services that they need. And then we also have a complex care management team of 3 registered nurses who also help high-risk patients navigate their chronic conditions and social supports that they have.
Okay. Now, finally, in regards to cancer prevention, you mentioned that you are a screening patient for cervical cancer and breast cancer. Are those services provided on site, or do you refer patients, for instance, for a mammogram?
Yes, no, they are, as long as it's a screening mammogram, it's done on site, and pap smears are also done on site.
All right. All right. Well, thank you so much again for this
Sure.
information. This is very helpful. I
Yeah,
appreciate you taking the time to talking to us, and
of
uh,
course.
and